Hey everybody! Today I'm going to talk to you a little bit about our diagnostic imaging rotation that we offer here at MSU College of Veterinary Medicine. This is a rotation that is required currently by all students rotating through our college. I'll start a little bit by introducing myself. So my name is Marion Welsh. I'm from Jackson, Mississippi. My path to vet med was slightly different than most. I was actually accepted into the early entry program as a high school senior. So I then attended undergrad here at Mississippi State, and I graduated in 2016 with my BS in biological sciences, and I started vet school in 2020. So I'm currently a third year vet student here at Mississippi State. And I wanted to talk to you a little bit about why I chose vet med here at Mississippi State. So I was actually born and raised in Mississippi State, Bulldog. Both of my parents attended college here, and my dad was even Bully, the mascot. So it was definitely ingrained from a young age that Mississippi State is the way to go. But what I love most about this school, both the vet school and the undergraduate master's program, is the family atmosphere here at Mississippi State. And I've noticed that from a very young age. Once you're a Mississippi State Bulldog, you're family, and family really truly does take care of their own. And that's one of the many reasons why I chose to come to vet school here at Mississippi State. So now we'll get back to talking about this wonderful rotation that we have here. And I'm going to introduce Dr. Marc Seitz, and he's currently the head of this rotation. So I'll turn it over to you, Dr. Seitz.
Thank you very much. As Marion mentioned, my name is Dr. Marc Seitz. I'm one of two veterinary radiologists here at the college. My colleague is Dr. Allison Lee. She's our fearless leader, our service chief, and I'm in charge of the clinical rotation and the diagnostic imaging class. Similar to Marion, I had a similar path to vet school. I decided I wanted to be a vet when I was about 12 years old and lived in Nashville, Tennessee, or rather Franklin, Tennessee. And most of my high school was going to a Tennessee university of some sorts. And I just needed to do something different. So similar to her, I found out about the early entry program. None of my family had gone to Mississippi State. In fact, when it came onto the radar, my parents looked at me and went, "What, really? Mississippi State? I've never heard of them." But we came down and toured, and similarly, my parents, myself, just fell in love with the people, the family atmosphere, and it was very clear that it was a diamond in the rough university with excellence in education, both undergraduate and veterinary. So I did my undergrad in biochemistry, animal and dairy science minor. I entered vet school, graduated in 2007. I then left and practiced general medicine for about 3 years, emergency for about a decade, and then came back to Mississippi State as an emergency faculty in 2015 before transitioning into imaging in 2018. So I am double boarded in both canine and feline practice, as well as radiology or diagnostic imaging. We're going to have a surprise visit from Marion's cat every once in a while, which is wonderful, absolutely wonderful. But I am now remaining on faculty as one of the two radiologists. I train residents, train students, practice clinical medicine. And in addition to that, I'm also the pre-vet club advisor for the undergrads. So if you do end up coming here, please, please, please check us out. We'll give you wonderful experiences.
Awesome. I didn't know that you were also early entry. So very neat.
Yep.
So we'll get started with some fun questions I've made. So Dr. Seitz, can you walk us through a typical day of a student on your rotation on diagnostic imaging?
Yep, absolutely. So diagnostic imaging is a third-year rotation, meaning you will spend 4 weeks with us sometime during your third year. One of the points of pride of our training here at the university is that we give you 2 years of clinical experience, whereas most other universities will only give you 1 year. So you will take radiology sometime during the third year, and for 4 weeks, you hang out with us. The days are structured very similarly, and that usually 8 to 10 is protected time for student rounds and student learning. And so different than the classroom, you're still working with veterinarians learning, but it's centered on cases. And so you're learning to apply that material that you had to memorize from textbooks the first 2 years, how to apply it to animals. And so I'm proud on our rotation, students over the 4 weeks will see 140 different cases. And that's the beauty of radiology. We can show lots of cases in a digital format and give students tons of experience. Then from 10 to 5, radiology is open for image acquisition, and students work alongside our technicians and our residents to acquire images and to learn how to take really good images that will improve how they interpret them. So really our goals are twofold. We want students to be able to leave our rotation knowing how to take good quality radiographs safely, as well as to interpret them to make a diagnosis when they're vets out in the real world.
I think that's a great point. So why do you think this rotation is so important to every student that rotates through our college?
Yeah, two main reasons. One, radiology is just integral in working up patients who are sick, and even helping to look at and evaluate patients that are healthy. Not a day goes by that a veterinarian doesn't have to look at a radiograph. But for those who don't go into clinical medicine, radiology is great because it teaches those foundational problem solving and critical thinking skills that are important for everything. So even if somebody ends up going into pathology or regulatory medicine, or any number of facets of veterinary medicine, they're going to use the critical thinking we teach in radiology out in whatever they choose to do.
And I thought you did a great job. I know coming from classroom and then coming into clinics, it was a little difficult to get into that mindset of thinking. And I noticed one day, I think all students were kind of struggling to get there. And Dr. Seitz said, okay, everybody calm down. We're just going to get together. We're going to work through it. And he did. And it was such a big help. And finally, after I think week 3, that thinking process started to click with all of us. And it was really interesting how I took that learning process that I learned from Dr. Seitz and diagnostic imaging and have taken it throughout my other rotations that I'm in currently. Like I'm on my equine rotation and I'm still using that thought process that I was taught there. So our next question is, what percentage of NAVLE is diagnostic imaging based?
I love it. So for our viewers that may not be familiar, NAVLE is the big exit exam that students have to take sometime during their 4th year to meet the requirements to become licensed in their respective state. So it's a big test. So over everything you've learned for 4 years, it's 300 questions spread out over 6 hours. That's 50 questions an hour. So NAVLE is a little bit coded and secretive in what's on the test, but I was able to get from them that 15 to 20% of those 300 questions are going to contain an image. The image may be a slide with cells on it. It may be an image of an animal's like skin lesion or an organ or a radiograph. And so when you look at, just the various categories, I would estimate that probably 5 to 8% of the questions are going to have a radiograph associated with them. So again, really important to make certain that you can function as a vet, but also pass that licensing exam.
Right. I didn't realize that the percentage was that high. So that was super cool to learn about that.
Mm-hmm.
Next, can you talk about the safety precautions that are put in place for students on diagnostic imaging, considering that we do know that x-rays have known cancer-causing effects?
Yep, it's really fascinating, but in America, radiation from medical sources like x-ray equipment accounts for the same percentage of radiation we get from things like space and the sun and radon and other materials, et cetera, et cetera. So we want to make certain we keep personnel who work with x-rays really safe so that they don't increase their lifetime risk for cancer, because we know if you don't take safe practices, your risk for cancer goes up. So all students and any personnel working with ionized radiation must be over the age of 18. We try to really discourage people who may be pregnant from working with it. And for those who do work with it, they are required to wear lead protective equipment. I actually have some behind me. This is my dinosaur lead that I custom made. The students get a kick out of it. But everybody is required to wear lead to protect them from the x-rays coming off the table, the patient, etc. As long as students wear protective equipment like shields, and we monitor their levels, usually they have no increased risk for cancer. We keep them safe. And then in addition to that, we also practice biosecurity and encourage them to wear gloves and protect themselves from some of the diseases that animals may have that can transmit to us. It's uncommon, but we want to keep our students as safe as possible.
I thought it was super important to learn about the effects of radiation, considering that we're going to be doctors in the workplace, and it's our responsibility to keep ourselves and our staffs when we get out in the real world safe. And even our younger kennel technicians that are watching us take good precautions.
Mhm.
So, Dr. Seitz, what is your favorite part in watching students throughout your rotation?
Oh my goodness. Honestly, it's the transition of going from week 1 to week 4. Nobody or almost nobody is inherently good at radiographs. And I hear it from students all the time. Oh, I stink at this. This is so hard. Second year, they leave with all these random facts in their head and just don't know what to do with them. And I heard a good analogy once that first and second year of vet school is learning to build up lots of file folders in your brain. And then literally all of third and fourth year is learning how to organize those file folders and get to them faster. And so you do that through repetition. And so the delight that I get to see is that transition from week 1 to week 4, where students come in scared, uncertain, they don't know how to talk professionally about radiographs. And then by week 4, they're articulate. They can, recognize 90% of the cases I put in front of them. They're confident. And the thing I love is that they're going out on externships and diagnosing things that sometimes their supervising vets are uncertain of, because not all schools emphasize really, really good radiology training. And that is Dr. Lee and I's goal. We want veterinarians to be able to handle 90% of the x-rays they take, the radiographs they take, and only have to send out 10% for a consult to a board certified radiologist like myself. There's a growing trend of people just saying, oh, I'll just send out all my rads. There's not enough radiologists to do that work. So I want all my students to just enjoy the pleasure of getting to decode those radiographs on their own.
I think that's awesome. I definitely feel a lot more confident. I remember I was shadowing at a hospital, and we took rads, and I was supposed to go and help interpret them before I took this rotation. And I struggled a lot, but now I feel super confident in that I can go in and recognize important effects in these radiographs and confidently say, okay, well, this animal needs to go to surgery. This, I'm not super confident in this. I can go talk with an associate and we'll come up with a plan.
Yeah.
Or this is an emergency situation, like we've got to take care of this now, which I think was one of the main goals of this rotation.
And I'll brag on you, your group, I think you had us for your first or second radiology rotation of all clinics, right? And so
Yes.
you guys came in nervous.
Very nervous, very
yeah, but all of you included, it just took off. And that's the joy of teaching. That's what I love seeing you guys do. And I would be confident bringing my baby Georgie to you guys to diagnose 90% of the common things that would happen to him. So you did phenomenal.
Well, thank you so much. Well, thank you so much, Dr. Seitz, for your time. Do you have any final thoughts for those that are going to be applying to vet school in the future?
Oh my goodness. I think the biggest thing is don't try to be the person on paper you think they want you to see. Be the person you are and let that just shine through. We are not looking for any one cookie cutter student. In fact, we like diversity. So just be yourself, get lots of good experience, and make certain you know about the profession that you're getting into. But you'll see there are all sorts of students here at State from all sorts of states and backgrounds. You don't have to have a mom and dad that's a vet. We are looking for just a diverse class to handle the diverse population that's out there in our country. you're looking for a school that's going to train you to be ready to go on the clinic floor, come join our family. We'd love to have you.
Oh, definitely, I agree. Well, thank you all for watching, and thank you, Dr. Seitz, for contributing to this. We hope you have a great evening, great time, and Hail State and go Dogs.
Hail State.